Ciao mondo, hello world, hola mundo, konnichiwa, ni hao, namaste, dobar dan. We are in Zagreb, Croatia, and we are surrounded by a group of friends here for a consensus conference. So Alex Zarbok from Germany, we have Eric Host from Belgium, Louis Forney from Great Britain, and Michael Joannidis from Austria. And of course I'm here as a representative of Italy, although we did not win the position at the football. Anyway, we are discussing about a special topic, and I will leave Alex to describe why this topic was chosen.
This topic is on acute kidney injury after cardiac surgery. This is a common complication after cardiac surgery and affects approximately 40 to 50% of the patient and is associated with a worse outcome. And in the last 10 years, we had several trials which were published, and we have new data, and we came together to discuss these new data, the new trials, and to come up with clinically relevant recommendations.
So this is the reason why the topic has been chosen. And what is the methodology we have used?
Yeah, we used the strict PRISMA methodology for systematic review. So we had 9 research questions. They were explored by 2 librarians independently of us who pulled all the literature. And this was assigned to small groups of participants who screened this literature and included or excluded the different papers depending on what they found in abstract or in full text.
Selection of members?
We have a selection of people from different specialities: cardiology, critical care, cardiac surgeons, nephrology, and from different parts of the world, and they are all with expertise in the field.
So a true multidisciplinary approach.
Yes.
So Louis, what are the outcomes of the conference so far at least?
So far, Claudio, we've addressed 9 main themes within the meeting, ranging from the use of biomarkers to enrich patient populations to study, as well as the use of various drugs on or after bypass. And so we've really looked at most of the post-operative journey of the patient to see how we can improve patient care. And hopefully at the end of the meeting, the outputs will be clinical guidelines to assess and look after these patients. But we haven't only done that, we've also had a section of our membership looking at the improvement in clinical trials and endpoints for clinical trials. So hopefully we'll also have a framework that people will be adopting to improve studies and hopefully outcomes for our patients.
And along this line, Michael, what would be the impact in the next future about this conference?
Yeah, just maybe as an introduction, this is the conference organized by the International Society of Critical Care Nephrology, and we are devoted to improvement of patient care, and exactly that's what we expect. We hope that these recommendations will help improving patient care, but we also strongly are convinced that it will improve and open additional research fields which should give us additional knowledge in this very difficult field.
So one important outcome, in my opinion, will be to have specific endpoints for clinical trials and harmonize clinical trials in order to be able to sum up the results and get a higher level of evidence. With this, thank you very much for joining today, Cappuccino from Zagreb, and have a wonderful day. Excellent.
Excellent.